Hello everyone, I am Dr. Nilendu Sarma. I am a dermatologist and practice in Kolkata. Today I will discuss something about atopic dermatitis, its pathogenesis, management, prevention, etc. Atopic dermatitis is a polygenic disease. That means multiple genes are working to cause this disease, but we do not exactly know what genes are playing the main role, but probably multiple genes are there that are defective, and this makes the person immunologically hypersensitive, and they manifest with different allergic manifestations like rhinitis, eye itching, skin pruritus, and in many patients there are IgE is raised. As I said, they are hyper responsive to normal stimuli that are present surrounding us. Like they are very prone to develop asthma, rhinitis, eye itching, watering from the eyes, and skin pruritus from different stimuli. Maybe that like dryness or sweating, any change of climatic parameters, change of weathers, synthetic clothes and any rough clothes. This makes lot of pruritus, and secondary to pruritus, there are skin changes like eczematous changes, acute eczema, or in chronic state there may be like anification. So it is apparent that there are multiple manifestations of the disease, not only in the skin. And the diagnosis of atopic dermatitis is thus a combination of multiple features. It is not a single feature that assists in diagnosis. There are multiple criteria laid down by Hennepin and Rajka. The modified the version is used, but since those criteria are very lengthy and it is difficult to use them in clinical practice, UK Working Party diagnostic criteria or classification criteria helps for diagnosis of atopic dermatitis. Pruritus is the primary feature, so it is important to rule out other pruritic conditions as well, like scabies in some country like us. And of course, there are other diseases that can manifest with pruritus, so those need to be excluded. And then if there are other features like very early onset, less than 2 years age, and associated other features like rhinitis, eye itching, asthma, family history, these help to diagnose a patient with atopic dermatitis. In atopic dermatitis, there are skin dryness and there is filaggrin abnormality in these patients that leads to dryness. It is now also seen that these patients, the microbiome, the natural or normal flora of organisms that we have in our skin, in our gut is altered. So the treatment and prevention of the disease need to target multiple aspects of the disease, like correction of the microbiome, reduction of the inflammation in the skin, reduction of pruritus. And since these patients, many of these patients are children, there's a lot of psychological problems due to the chronic course of the disease. So correction of their psychological status is also very important. Anxiety, frustration is often associated due to persistent pruritus. There's a lack of sleep, disturbance in attention. So these all need to be addressed. Regarding correction of the skin inflammation, we have to give some topical steroid or topical calcineurin inhibitors or other newer topical drugs, and then we can start topical steroids. And there are multiple topical steroids. Some can be used in thicker skin, some can be used for a short period in flexural areas. Usually we do not recommend topical steroid on face or some flexural areas like groin, etc. If the patient doesn't improve, then for reduction of inflammation, we can use for a short course of systemic steroid or other immunosuppressants. Regarding correction of skin barrier functions, that is also damaged. As I said, there's a defect in the filaggrin. We have to use multiple moisturizers depending on the weather. It can be lotion, it can be cream or ointment. And depending on the body parts, like some can be used on the body, some can be used on the face. So correction of skin barrier is very important. This reduces penetration of the skin by harsh chemicals. So avoidance from the harsh chemical is also very important. Third is reduction of itching. Antihistamines are commonly used, but it is said that histamine is not the only mediator of itching in atopic dermatitis. So apart from antihistamines, there are other molecules that can be used. Regarding psychological and stress management, we can use different molecules that reduces the stress in these patients. This is all about atopic dermatitis in brief. Regarding some newer molecules like JAK inhibitors are used nowadays. There are biologics, dupilumab and other molecules that are also used. There are other newer molecules also that are still not widely available in India. This is how we can treat the patients of atopic dermatitis. I hope my video talk will help everybody to learn something about atopic dermatitis. Thank you.
For more such videos, visit or log into dermavidya.com.